Hi, this is Dr. Martin Rutherford, and this is a segment on functional medicine back to basics. Last segment was on chemical sensitivities. We went into that pretty extensively. Chemical sensitivities can be there. They can be at that spot right after the gut, right after the small and large intestines. They couldn't be later. It's something that it depends on the person's history. But right now, this is a good relative order in the way you would attack a chronic condition case, which is mostly what we see: chronic conditions, neuroinflammation. We see autoimmunity a lot, but even just a strict gut case, this is the way you would attack. So this week's on stomach. Stomach is, I think it's highly underestimated as a part of chronic conditions. Most people are really aware of the intestines now. It's on the 4R program, the Heal Your Gut, all these different programs for that. Do the autoimmune paleo diet and take some supplements and keep your fingers crossed, and sometimes it's going to help. But the stomach is frequently missed. And if you've done an autoimmune paleo diet, or if you've been diagnosed with small intestinal bacterial overgrowth and you've done that, or you've done any number of things for your diarrhea, your constipation, and they worked for a short period of time, and then they stopped working, you're going to find out why right now. Because the stomach has a huge player in not only helping to get those under control, but they are a huge player in keeping them under control once you've done one of those programs. So the stomach, it digests your food, and one of the main things it does is, one of the main features of it is hydrochloric acid. Okay, hydrochloric acid is designed to primarily digest your protein. Your stomach's a very acidic area. For those of you who are alkaline people, you tend to dampen this response, which is not a good thing. So it is the beginning of the chain. It's actually not the beginning of the chain of digestion. The beginning of the chain of digestion is actually smelling your food, seeing your food. That actually creates a beginning of the digestive process in your stomach and your pancreas and your gallbladder, and then of course chewing your food. But then after that, the next thing is hydrochloric acid. So first, there's low hydrochloric acid symptoms, and there are high hydrochloric acid symptoms. If people think about their stomach and they think about symptoms, my experience is mostly they say, well, I don't have an ulcer. Or they say, I have, or they say, I do take antacids because I have acid ingestion. And one of those is too much acid, one of those is too little acid. The problem with the stomach environment is usually too little acid. And I think it's important to walk through that. Let's first walk through other symptoms that are stomach symptoms that you may not connect with the stomach. One is excessive belching, burping, or bloating. And that would seem like it could be a number of things, but that would be excessive belching, burping, and bloating after you've eaten protein. I just had a lady yesterday, patient, and we're close to the end, and she started to reintroduce some foods. That's what it was. She switched over to the keto diet, and typically she's starting to eat more meats than she probably should, and she's having a hard time. And she's having a hard time digesting, and she's getting gas and bloat. Well, it's because she doesn't have enough hydrochloric acid in her stomach, and she's now trying to digest more protein. So usually the gas and the bloating from the stomach versus, say, pancreas or gallbladder or SIBO would be if you are not able to digest protein. I ate a protein meal, I'm getting gas and bloating. That's usually lack of hydrochloric acid in your stomach. We're going to talk way more about hydrochloric acid in a minute. So gas immediately following a meal, same thing. Offensive breath. So many of the people who come in here are health-minded. They are brushing their teeth. They are flossing their teeth. They are going to the dentist. They're doing the right things. And yet some of them come in here and their breath is really horrible. And they're embarrassed by it, of course. We smell their breath to see what it smells like, because breath coming from a lack of hydrochloric acid in the stomach has a very distinct smell, and it can alert us to the fact that that person doesn't have enough hydrochloric acid in their stomach. Difficult bowel movements. One of the number one causes of constipation, possibly the number one cause of constipation, is stress. And stress creates a situation where it puts you into something called fight-flight. And when you're in fight-flight, your nature kind of knows that you don't need to be eating, peeing, pooping, so it shuts all of that down. So if you're in chronic stress, it shuts down your stomach, your intestines, your urinary bladder. And so stomach, if it shuts that down, what happens is you stop making hydrochloric acid for that period of time. But if you're chronically stressed and you shut down that hydrochloric acid, there's a chain reaction from not having enough hydrochloric acid. And that chain reaction is you're not making enough hydrochloric acid. That sends a signal to your gallbladder not to work, because it doesn't want you're in fight-flight. We don't want your gallbladder to work either. You don't need your gallbladder doing anything while you're trying to run from the bear, right? And then that will help to shut down your pancreas, for all you pancreatic enzyme fans. And so, and that is a stress response. And then those, if you're in stress long enough, can create inflammation in the intestines. And for there, I'm just trying to point out at this point in time how important not having enough hydrochloric acid in your stomach is and where it comes from. So difficult bowel movements will happen when you have all that happening. You're not digesting your protein, you're not digesting your fats, you're not digesting your starches, because all those organs aren't working. That's the number one cause of constipation. Sense of fullness during, the other thing, by the way, second most common cause of hypochlorhydria, low hydrochloric acid, is thyroid. Hypothyroid, Hashimoto's thyroid, slows down the ability to make hydrochloric acid. Sense of fullness during and after meals. Of course, you're not digesting your meal because you don't have enough hydrochloric acid. Difficulty digesting proteins with meals, undigested food found in the stools. These are symptoms of low hydrochloric acid. They can and that can be caused by stress. That can be caused by like I just said just a few minutes ago. It can be caused by low thyroid. Those are the two most common causes that come into this office. That can be caused by H. pylori. H. pylori is a bacteria that you get in your stomach that will actually cover the inside of your stomach and cause you to not make, well, you'll still make hydrochloric acid, but the hydrochloric acid can't be expressed because the parietal cells that are making it are being covered by a bacterial infection. So not having, in my world, not having enough hydrochloric acid is probably more important to look for immediately than whether the person has too much hydrochloric acid, because as I'm going to tell you here in a second, too little hydrochloric acid leads to you having symptoms of too much hydrochloric acid. Just bear with me on this, okay? So what are the symptoms of too much hydrochloric acid? More people know these than know the symptoms of not enough hydrochloric acid. Stomach pain, burning, aching, when just right after eating. Use of antacids. This is like the number one thing. Feeling hungry an hour or two after eating. Heartburn when lying down or bending forward. I'm going to stop on that one. Heartburn when bending down or lying forward can also be a hiatal hernia. And I don't have any, to my knowledge, we should do something on hiatal hernia, because I don't think I have any presentations online on hiatal hernia. But hiatal hernia is when your stomach pushes up through your esophagus It could be because you were vomiting. It could be because you bend over too much. It could be because we sit too much. It could be because you can lift too much. And it pushes up your stomach into your esophagus, and then your acids become available to your esophagus, and then it starts burning your esophagus. Long-term hypochlorhydria, low acid, long-term hyperchlorhydria, too much acid, or long-term hiatal hernia, all can lead to something called Barrett's esophagitis, esophageal esophagitis, some of the things that some of you watching this may have. It's something I see semi-commonly. Heartburn, when you're laying down or bending forward, then can be too little hydrochloric acid. It's usually too much hydrochloric acid, and it can be a hiatal hernia. Temporary relief by using antacids, that's too much acid in your stomach. Digestive problems subside with rest and relaxation. That's too much acid. Heartburn due to spicy foods, chocolate, citrus, peppers, alcohol, and caffeine. By that time, the inside lining of your stomach is starting to disappear. Okay, so we have low hydrochloric acid in stomach problems. We have high hydrochloric acid in stomach problems. Now, we briefly have talked about the importance of low hydrochloric acid, because if you have low hydrochloric acid, to go over it again and take it one step further, you eat food, the proteins don't get digested. The food then sits there. The proteins actually sit there. This is a step I skipped previously. The protein sits there. It is what becomes acidic in a case of low hydrochloric acid. This is by far the more common reason for you having acid indigestion, because it takes a long time to get where we're going to get to in a minute with the high hydrochloric acid. So the protein starts getting acidic, and then what happens is it gets putrid. It starts to burn, and then your digestive system has a lot of checks and balances, a lot of fail-safe mechanisms, a lot of governors, if you will, okay? And so this is the biggest one. If you don't have enough hydrochloric acid, the food gets putrid, the food gets acidic. It now sends out a hormone to your gallbladder called cholecystokinin, and it tells your gallbladder to not pump. For all you people who've had your gallbladders out, why did they take it out? Because it started pumping slower. What did they tell you? Your ejection fraction is slower. And when that happens over a long period of time, guess what else happens? You start to get sludge. And then guess what else happens? That ends up turning into small stones, and then large stones, and so on and so forth, if you've had low hydrochloric acid over a long period of time, from usually chronic stress or hypothyroidism, or ultimately maybe H. pylori. These are the things that cause it, okay? Now, that gallbladder and that stomach also now alert your pancreas. Hey, I'm about to send a bolus of food down in there that is not digested properly and is acidic. Stop working, pancreas, because if you keep pumping out enzymes through your little duct, inflammation from that acidity of that food is going to get in there, and you're going to get sick, okay? And this is how some people get pancreatitis without drinking alcohol, okay? But the bottom line is low hydrochloric acid shuts down gallbladder. Both of those shut down your pancreas. Now you're not putting out pancreatic enzymes. Now you're not digesting your proteins. You're not digesting your fats. And most people don't realize that these organs do more than that. Your gallbladder actually helps with immunity. It helps with inflammation. Your pancreas puts out enzymes that are anti-inflammatory. If you want to know how to get an inflamed intestine, then don't have enough hydrochloric acid in your stomach. How did that happen? Usually by stress, usually by low thyroids, usually by H. pylori. Those are the biggest ones. There are other things, but that's probably 98% of the reason that people have low hydrochloric acid. And the next thing you know, you start getting bad bacteria in your stomach. Why do you get bad bacteria in your stomach? And then you get bad bacteria in your intestines. Why do you get bad bacteria in your intestines? Because the hydrochloric acid is not just there to digest your protein. It's there to kill bad guys. It's there to kill bacteria. In fact, even though it's kind of a reciprocal thing, even though H. pylori infections can cause lack of hydrochloric acid, you almost can't get a H. pylori infection in your stomach if you have enough hydrochloric acid, because it's going to, and I'll tell you in a minute why the other thing would be, but because it's usually going to kill that. It's usually going to kill that bacteria. It's going to kill candida. It's going to kill viral infections that come in, even if you're like out there and you're drinking bad water, and you have enough hydrochloric acid, then it may even kill that. Although the water goes through a lot quicker, it may even kill that. Okay, so the hydrochloric acid also is like the guard at the door to try to make sure you don't get bad viruses, you don't get bad yeast, you don't get all that stuff in there. Now you don't have enough hydrochloric acid, all that stuff starts happening. If you don't have enough hydrochloric acid for a long enough period of time, then you start to get damage to the inside of your intestines because you have infections in there, because you have food that's not digesting properly. And most people say, and then what happens is you start getting very acidic. Now let me stop at this point. At this point, many of you are taking antacids. But antacids are going to do what? They're going to kill what little acid you have left. This is so common. It's like mind-boggling how common this is, okay? So you're now perpetuating the problem. So now we know what a little bit of acid being left causes. Now you have no acid left because you're killing everything. Now you're perpetuating everything we just got done talking about, and now you're taking them over a long period of time. The inside lining of your intestine starts getting bad because there's inflammatory responses because you don't have the enzymes and those types of things to kill it. And the next thing you know, you stop absorbing things. Now you can get malabsorption. Now you can get osteoporosis, and you can get all the other things that you can get in your intestines. You can get all kinds of intestinal problems. So like, omeprazole and those, pantoprazole and those types of things. If you are taking those and you have been confirmed as not having an ulcer, find another way. There are lots of other ways. Herbs, botanicals, there are a lot of other ways to get over that acid indigestion until you take care of whatever's causing it. Bad diet could cause it too, but the number 1 and 2 causes are usually stress and thyroid. And so now, we move from hypochlorhydria to hyperacidity, okay? But you get the hyperacidity because now, after you've had low hydrochloric acid for a long period of time, and if it's because of stress, for sure, you're now going to have it so long that it's going to start to damage the inside of your intestines. Now, at this point, when you have damage the inside of your intestines, you're definitely going to check that person to see if they have H. pylori, okay? Because they're not going to be killing their bacteria. Because first they had low hydrochloric acid, now they have high acidity because the inside lining of their stomach is being affected. They can't eat any of these things. They're taking antacids, and so the damage is happening to something called the parietal cells in there. The parietal cells are what make hydrochloric acid. So when you start getting damage to that stomach, now from having the hypoacidity for so long, that's now causing the damage. Now you start getting an inability of the cells in the lining to make hydrochloric acid because they're being damaged. So that could be because you had hypoacidity for so long. You could get that hyperacidity separately other than the low hydrochloric acid if you have an autoimmune problem. So if you have, let's say you have Hashimoto's, let's say you have rheumatoid arthritis, let me say lupus, whatever you have, you can get other antibodies that will attack the inside of your stomach separate from everything I just got done saying. And so if you come into a person and if you come into a doctor and you have that type of an issue, they should be checking you for hypochlorhydria. They should be checking you for autoimmune antibodies. In other words, antibodies to the inside the parietal cells on the inside of your stomach that are being destroyed by the acidity that you're having at that point in time. They should be checking you for H. pylori, because if you have poor hydrochloric acid, or if you've advanced to the point where you're having stomach symptoms or actually ulcers, you're not making enough acid to kill the bacteria. H. pylori is almost a standard. If you do the test, it's almost always going to be there. And so this is stomach, okay? And the big thing about this is as you're following me, you're probably thinking, wow, it's pretty important to have like enough hydrochloric acid in my stomach because it screws everything else up. And the answer is, that's right. But the hydrochloric acid comes first, so you have to figure out, where are you? Are you just at the point where you don't have enough hydrochloric acid, or are you at the point where you've crossed over to the dark side and you now have actual damage to the inside of your intestines? And or do I have H. pylori, and do I have parietal cell antibodies that are attacking the inside of my stomach? This is stomach, okay? This is stomach. Now, there's a lot of weird things that can happen to the stomach other than that, but these are pathologies that rarely happen, and they're something that people would see if they do an endoscopy or something like that. This is 99 9/10% of the people who come in to this office. This is the flow. And again, we're talking about flow. We're talking about there being an organization to this and a hierarchy. So, and many of you, if you go back, you'll understand we've already looked at stress responses. We've already looked at those types of things. And we've looked at your intestines. Your intestines being violated can, in turn, like if you've developed celiac, or if you've developed Crohn's disease or ulcerative colitis first, the inflammation from there can certainly feed back and can certainly cause an abnormality in stomach function. And so that's another thing that you kind of need to be aware of as far as that goes. But again, those are not a huge part of the population. I don't know what the percentage is, maybe 6% of people who have gut problems have those autoimmune issues. The rest, this is what you're looking at. So the big takeaway from this, to me, is I go back to those of you, today everything's on the internet, everything, people come into me today, it's way different when I started, when people had no clue as to anything about anything relative to why they had autoimmunity, or what was going on with their thyroid, or what was going on with their gut. Now, the 4R program, the 5R program, the SIBO program, the autoimmune paleo diet, all these programs are all over the place. And people who are looking at this, like yourself, probably have already looked at all those things. Many of you have probably tried all of those things. Many of you have gotten no help from them, or many of you have gotten help from them for a short period of time, and then 2 weeks later, 4 weeks later, 6 weeks later, 8 weeks later, boom, everything came back. You got discouraged. You said, oh my God, I thought I had SIBO. I was right out of textbook. I did everything. It was better. Now it's all back. Now I'm so bummed out. Oh my God, it's not that. But it could have been that. But if you have small intestinal bacterial overgrowth, okay, and you do that whole thing, that whole dietary regime, and you use the proper herbs and botanicals and stuff, and it comes back, it's because most likely you didn't have enough hydrochloric acid in your stomach to kill it and keep it away. And by the way, for those of you who are the alkaline people, you need at least a little bit of acidity in your intestines, and you need a lot of acidity in your stomach so that you can kill things, and so that you make the environment in your intestines just a little hostile, so that these viruses and these bacteria and stuff don't come back once you've killed them. So that's kind of, I think, the extent of really what you need to know about stomach. I think that's really the critical core of it for those of you who have gone through, again, this whole series is relative to back to basics of what functional medicine is supposed to look like. And the breadth of functional medicine, the organization of functional medicine, the hierarchy of how you attack things to the degree that you can do that. And so that is really, this is a huge, 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 huge key to the entire hierarchy of attacking almost any problem that walks in this door relative to gut problems having immune responses that are attacking other things. If you do all the right things and you don't get the acidity in your stomach under control, or you don't get the stomach under control, you're not going to get a long-term response. So this is one of my favorite subjects. I could go on for hours and hours and hours and hours on this, but there's lots of data online relative to this particular type of a condition, and if you want to look those things up and verify it. But this is the core of stomach. This is the testing that you would do, and this is the testing that you would do when you would do it, and it's such an important part that if you're having any of these problems, I would rewind this thing, rewind this thing. I would replay this thing. You can tell where I'm at, right? Where I come from. You could replay this thing a couple of times and then kind of compare it to your symptoms. And I think you will find, the success, the solutions are dietary, the solutions are supplements. Sometimes the solutions are just getting hydrochloric acid in there. Sometimes you take hydrochloric acid and it burns you, so you have to actually, maybe you got autoimmune gastritis because you have positive antibodies against your parietal cells, and you're not making enough hydrochloric acid, so you may have to get the immune response. That's a whole nother animal. That's a whole nother presentation, but it is extremely doable the vast majority of the time. So, so that's an important presentation. Back to basics, and I'm a big back to basic guy. I'm a big fundamental guy. There's a reason for that, and this, again, I can't reiterate this enough. This is one of the most important aspects of what we're doing. So next time we'll be going on the pancreas, which will be, frankly, a pretty short presentation. So I'll see you then with pancreas.